Good morning again. My name is Ameesha Mehta-Sampath, and I'm from EPA Region 2. It's such a pleasure to see all of you here today. Many of you are the experts in our region working on the asthma issue for many, many years. And this regional summit that focuses on sustainable funding for asthma in-home interventions is our next step, the step to address healthy outcomes, significant health outcomes for our asthma patients, as well as achieve significant cost savings. For many of you, this has been a journey. A quick fun fact, 15 years ago, around the same time, EPA, in collaboration with HHS and Mount Sinai, hosted an asthma summit, which focused on the clinical and environmental management of asthma. So it is much more research-focused, science-focused, and the idea is like, look, we have all this information on triggers, how can we incorporate it, how can we actually utilize it in the field to ensure that we're reaching significant health outcomes for our asthma patients. And the most interesting thing is that after that summit, everyone, whether it's from the state, from the city, from the federal agencies, community organizations, all started working on incorporating asthma in-home interventions. They looked at the various triggers, they tried to figure out what's the best approach, how to get into the homes, etc. And 15 years ago, these rates were much higher. You had about 11 to 12% for New York, New Jersey, and Puerto Rico. It is close to 19%. But this is what the rates are as of 2013. We still have a long way to go. And the most interesting thing is that the healthcare costs just keep rising and rising. $65 billion estimated annual cost of housing-related illnesses and injury nationwide. In New York State itself, it's $1.3 billion. So as I'd mentioned to you before, 2000 to 2006, EPA's asthma program really focused on the science. 2006 to 2012, we focused more on policy, working with HUD, incorporating HUD into the team and looking at asthma disparities, looking at the NHLBI guidelines. And now we're in 2012 to the present time, where we know we have years and years of experience showing that if you do a combined effort, clinical case management as well as asthma in-home interventions, you can achieve success with your asthma patients, where they're not in and out of the emergency room, you're having reduced hospitalizations, reduced urgent care visits, and also reduced missed school days. The main reason why kids miss school is because of asthma. And if the child is missing school, the parent is missing work. So what's EPA's goal? It's to have partnerships with feds, states, territories, tribes, NGOs, foundations, academic institutions, and communities. And we have various cooperative agreements. One of the main ones that I want to highlight is with the America's Health Insurance Plans. So the America's Health Insurance Plans, which is the main organizations the various commercial and managed care organizations fall into, actually completed a survey. And if you focus on the third rectangle from the top, it says nearly all Medicaid, which is 93%, and 2/3 of commercial plans, which is 66%, agree that environmental asthma management can reduce unnecessary healthcare utilization. This is great. However, it's not happening. Over the past 10, 12 years, EPA as well as other HHS has provided millions of dollars in funding to community organizations, to hospitals, to various other providers to address asthma. But what happens is that once the grant funding runs out, then things go back. So we are at a stage that if you really want to make a difference, we need to achieve sustainable funding. And how can we do that? What are we looking at? So the funding streams, we have two areas: health, obviously state Medicaid plans, private plans. Then in the area of housing, the various community development, block grants, healthy home programs, weatherization programs, code enforcement. And a funding strategy that's emerging is social impact bonds. So what we're so pleased as organizers for this conference is that we have been very, very lucky that we have these innovators from around the nation that have worked either on Medicare legislation or social impact bonds. They're here today, and they will be talking to you and giving you their experience and how they got it done. So what do we mean by braided funding? You know, it seems very onerous if we expect only one agency or one managed care or commercial plan to actually take on the bulk of the costs. But if we look at it at much more of a braided approach, whereby in-home asthma care programs often braid separate funding streams together. You pay for more services than one stream can support on its own. Carefully track expenditures to report back on how money was spent. And a diagram that highlights that is this diagram where you have health funding, which is Medicaid, private insurance, state and local health departments, wellness programs. Other potential funding could be state funding, prevention and wellness trusts. There are tobacco master settlement agreements out there. Potential funding also pay for success, social impact bonds, and philanthropy. And then, of course, our healthy homes, our grants with our partner, HUD. And the different levels of interventions, you have supplies and services, structural services. But you'll hear as you go along the day about what's the key components that need to be part of the interventions, and that how important it is that we really focus on prevention and not reaction.